This is vitamin D3. Now, this is a supplement that's very cheap and very available. Vitamin D3 is involved in the activation of over 900 genes in human cells, and this is absolutely essential for a properly functioning immune system. Now, I would actually argue that without proper levels of vitamin D3, our risk for viral infection, bacterial infection, but also cancer is dramatically increased. Yet, more than 75% of the US population is deficient in this vitamin. And deficiency in the literature is usually classified as blood levels less than 20 nanograms per ml. And that, in my opinion, is way too low. I would actually argue that an optimal level needs to be around 50 nanograms per ml, which, if you read the literature, is almost classified as being too high, as being problematic, which I don't think is true. The reference range actually can go up to 100 nanograms per ml. I don't think there's much benefit of going above that. But between blood levels of 50 and 70 nanograms per ml is when we see most of the benefits of vitamin D3, which is preventive in terms of getting infections, but also preventive in terms of cancer. Now, in this video, I'll talk about how vitamin D3 can help to prevent cancer, but also be an adjunct in helping to treat cancer. And these effects are actually quite profound, as you will see. And when I asked the AI program Perplexity how many cancer deaths annually can be prevented just in the US population if we got everybody to an adequate level of vitamin D3, that number is over 90,000 people. So that is a huge number of deaths that actually can be prevented just by virtue of adequately supplying the right amount of vitamin D3. And it is quite a shame that the medical professionals are not really pushing for this. Because when you look at what's portrayed in the media, there's always warnings about taking too much vitamin D3. And of course, that's a possibility. You can overdose on anything, even though in the case of vitamin D3, that's actually quite difficult to do. But I'll talk about that as well. But in general, we have the opposite problem. People are not having enough vitamin D3. And that's partially due to us spending less time outside, especially in the summer months, where we get our vitamin D3 production from sunlight. Now, today we're spending about 7% as much time outdoors as about 100 years ago. So obviously that's an issue. And secondly, we're using a lot of sunscreen. So even when our skin is exposed to the proper UV radiation, we're blocking the UV from doing the job in the skin, which is actually to help produce vitamin D3. Now, the other thing is, of course, that our nutrition is deficient of vitamin D3. We don't get enough in from our regular foods anymore. And then supplementation is something that most people don't do adequately. And the levels that are recommended for supplementation by the RDA are really laughable. It's something on the order of 400 to 800 international units daily, which is way too low in my opinion. And beyond cancer, even if we look back on our recent pandemic, for example, when we look at how our viral illnesses mitigated with adequate vitamin D levels, many scientists have argued that if we had adequately supplied vitamin D to the population, or at least tested people if they're deficient in vitamin D3 and then corrected appropriately. No one talks about overdosing here. We could have significantly decreased the death toll and sickness that we had in the last pandemic just by virtue of adequately regulating vitamin D3 levels. But it was not done. It was not encouraged. And most professionals today either are not knowledgeable about this topic or are ignoring it completely. And that's a shame in my opinion. Yes, of course, the pharmaceutical industry is not interested in this. This is a cheap, like I said, supplement that you can buy over the counter. You don't need to go to great lengths of getting some very fancy stuff here. It's available, it's cheap, and it works extremely well. I want to talk a bit about the mechanisms that vitamin D has where it can prevent or even attack cancer cells. Now, I don't think that vitamin D3 in itself is a cancer treatment. It should always be used as an adjunct. And if someone is suffering from cancer, I strongly encourage you to talk to your treating physician to make sure at least do a blood test to see where your levels are. Because what happens in severe illness, and cancer being one of them, levels drop even more. And without adequate vitamin D levels, even traditional treatments like chemotherapy are not very successful. So they do need adequate vitamin D levels in order to succeed. So you should always talk to your doctor about at least testing a level and then making sure you're in the appropriate range. And again, in my opinion, that is more than 30 nanograms per ml. I think people should be around 50 nanograms per ml. Just my opinion. Again, talk to your physician about this. But this is very important, especially when you're sick. And in the winter months, of course, again, the best thing is to get tested, see where your levels are, and dose accordingly. Don't overdose, of course. But again, make sure that you're within the adequate range there. This is very important. And it's not just to decrease your likelihood of getting a viral illness or decreasing the severity of the viral disease, but also to make your body healthier in general. Because again, it really massively boosts the function of your immune system. And that is essential from anything from viral infections, bacterial infections to cancer, but also to avoid autoimmune disorders. There are many, many things that vitamin D can really help us to prevent, in my opinion. So when it comes to cancer, one of the functions that vitamin D3 has is that it can inhibit cancer cell proliferation. And it does so by causing a cell cycle arrest at the G1 phase. So when you think of the phases that are involved in cell division, and cancer cells, of course, have to go through cell division as well, and they're dividing at a much more rapid rate than healthy cells do, this cell cycle can be arrested by vitamin D. Again, it's not exclusive. It's not going to be sufficient to treat, but it actually will slow things down significantly. And anything that can decrease the proliferation of cancer is, of course, something that is really valuable. It does so by downregulating cyclin D1 and upregulating P21 and P53, which are key proteins that are involved in cell division. So it blocks that, and it's very specific to cancer cells. So it doesn't really inhibit this division in healthy cells, right? And it's dose dependent. So you have to have the right amount, again, of vitamin D3 in your system. If you don't have enough of it, that's really difficult to do, right? So studies have shown dose-dependent decrease in cancer cell proliferation viability with vitamin D3. And this reduces the number of dividing cells, and it does promote cell death in cancer cells. Another function of vitamin D3 is the promotion of apoptosis and autophagic cell death. Now, apoptosis is cell suicide, and it tells the cancer cells specifically here to commit suicide. And this is a normal function that we usually have in malfunctioning cells. Cancer cells, unfortunately, usually have mechanisms by which they bypass this apoptosis process because they are malfunctioning cells. And malfunctioning cells usually commit suicide so they don't become harmful to the body. But in cancer cells, this mechanism is disrupted. Now, vitamin D can trigger apoptosis in cancer cells by increasing pro-apoptotic signals, right? And this is something that it does specifically, again, in cancer cells. It does not harm healthy cells here, right? This leads then to cancer cells having fragmented DNA and cellular breakdown. So it kind of dissolves the cell and then it gets absorbed, right? But there's also evidence that vitamin D3 is involved in inducing autophagy. And autophagy is really a process by which a cell can digest some of its own components that are malfunctioning. And this is further reducing or eradicating damaged or cancerous cells. So by this also, because a lot of the cell is malfunctioning, when the cell gets cleaned out, it usually ends up in cell death as well. So these two mechanisms are significantly decreasing the amount of cancer cells that are present. Now, as cancer is developing, tumors form, and these tumors are at some point needing their own blood supply because they are a close cluster of cells, and to get sufficient nutrients in there for these very fast dividing cells, they need extra blood supply, right? And this is called angiogenesis, the formation of new blood vessels, right, to supply the tumor. And this is a big problem because it can also lead to cells then spreading from the tumor to other sites, right, by virtue of having these vessels form. And this formation of new blood vessels, angiogenesis, is inhibited by vitamin D3, and it's largely via a reduction of vascular endothelial factor, or VEGF synthesis, and the HIF1 pathway. So there's some specific pathways by which vitamin D3 can prohibit the formation of these blood vessels in tumors. And that's, of course, hugely important. Again, one, to stop the tumor growth, or it can actually cause the tumor to ultimately collapse or undergo necrosis by virtue of not having enough nutrients, but also by decreasing the risk of the cancer spreading to other tissues. Furthermore, vitamin D3 can also interfere with pathways for cell movements. We're talking about cancer cells again here. And this is making cancer cells less able to invade nearby tissues or to spread. So there's a specific mechanism by which it can inhibit that. So they stay more local, which is, of course, a much better prognosis for treatment. When we can keep it at one site, it can be treated there, rather it's spreading systemically, which can cause a lot more problems down the line, of course, right? And in some colorectal and breast cancer models, vitamin D3 has been shown to decrease markers that are related to cell migration, invasion, and metastases. Studies have also demonstrated that vitamin D can suppress the epithelial mesenchymal transition, or EMT. And this is something that's crucial for metastases and therapy resistance. So when we're treating cancer with drugs, sometimes there's resistance to these drugs. And vitamin D is helping actually decrease this resistance through making these cells more susceptible to the treatment or to the medications in this case. Another very important part about how vitamin D3, and there's some overlap with other medications here, is helping to eradicate cancer is the modulation of cancer stem cell growth. Now, cancer stem cells are slower dividing cells. So a lot of times they're not caught with chemotherapy. Chemotherapy usually attacks very fast dividing cells. And the problem with cancer stem cells is if they're left behind, there can be recurrences. So a lot of times we see people recovering, they've had, let's say, chemotherapy, radiation, and other treatments, and the cancer seems to be going away. And then after a significant amount of time, suddenly the cancer can come back. And that's because the stem cells have not been attacked. Now, vitamin D3 is actually making these cancer stem cells much more susceptible to being eradicated and can actually help eradicate them. And this is important. There's some overlap to other medications that we're studying right now. Again, I'm not saying that these are current therapeutics, but if we look, for example, at ivermectin triggers apoptosis in cancer cells. It can also decrease angiogenesis like vitamin D does, but also it can attack cancer stem cells. And this is something where these treatments seem to be superior to traditional treatments because, again, the cancer stem cells usually are not touched by other treatments, right? They're very difficult to get to. So this is something where a strategy that combines vitamin D3 with other potentially repurposed drugs might be superior to traditional medications or should be used in conjunction with them, because obviously when you attack from different angles, then you also usually have a better outcome. Now, in terms of preventive mechanisms of vitamin D3, where it can prevent the onset of cancer or other diseases, is that vitamin D3 can enhance DNA repair capacity by activating repair enzymes. And this is preventing DNA mutations, which we know are a big issue, especially when we look at uncontrolled cell division. And this is something that can usually cause a cell to become precancerous and ultimately a cancerous cell. So this is something that vitamin D3 is really helpful in preventing. So again, the best strategy is usually for your health is to prevent the disease from happening, right? Of course, we want to know the steps that we need to take in order to treat. And as I mentioned before, vitamin D3 is very essential in the prevention of disease as well. So within the cell, vitamin D3 can upregulate antioxidant proteins, and this is helping the cell to fend off oxidative stress, which is, of course, a driver of both cancer initiation and progression. So it's something that needs to be stopped in order for cancer to occur in the first place, or if cancer has already occurred, to decrease the severity and to decrease the spread here. Now, vitamin D3 also suppresses pro-inflammatory pathways, and chronic inflammation is a major risk for disease. And I've talked about this in other videos. Inflammatory processes are usually at the root of diseases before they really start becoming problematic. And interestingly, inflammation is really needed for cancer to flourish. And we know this because there's medications that we're using right now which are anti-inflammatory in nature. For example, low-dose naltrexone. Now, naltrexone is something that people usually know from addiction medicine in higher doses. But a low dose of naltrexone has been shown to be very beneficial in cancer treatment. We're talking about only about 4.5 milligrams here, a very low dose, because it decreases the inflammatory environment around the tumor. And it's been shown that cancer or tumors in general need an inflammatory environment. They need a low oxygen environment. And this is something they need to flourish, because remember, they ferment. They don't really use oxygen. They don't go through elaborate citric acid cycle to produce energy, but they ferment, a very primitive way of making energy. And this is usually done in the absence of oxygen. So oxygen is actually quite harmful to cancer cells. So they want a low oxygen, high inflammatory environment. And vitamin D3 can decrease this inflammation. It's one of the components that we have that can bring down the inflammatory process and therefore really help, again, to decrease the risk of onset, but also to mitigate the disease if it has manifested already, right? So it can really lessen the tumor-promoting microenvironment, and it can really decrease the evolution of cancer. Other preventive mechanisms that vitamin D3 has is that it can increase antimicrobial peptides, and they can destroy pathogens directly, of course. Boost the activity of natural killer cells, very important. And you will hear this more and more as we do more research in cancer. Natural killer cells are very important. And if we can, again, boost this activity, it's really fantastic. Macrophages are other immune cells that are boosted with vitamin D3 or optimized with vitamin D3. And then, of course, it modulates cytokine production. But when we think of the immune cells, again, I think it's really important to understand that without adequate levels of vitamin D3, our immune cells in the immune system, they are really like high school students. They're not ready for the workforce. They need this education. They need to mature. They need to learn. And then once you put vitamin D3 in the mix, they become functional. Now, you have a lot of immune cells that are not functional without adequate vitamin D3, and therefore your immune system is vulnerable. And we always know that whenever we have a suppression of the immune system, and that can sometimes be done with medications. Think of people suffering from autoimmune disorders. Sometimes they get medications to artificially suppress the immune system to drive down the overreaction that they experience, right? But one of the main side effects is cancer. And why is cancer a side effect? Because, again, the immune system gets suppressed. The immune system, again, can weed out not just bugs, not just viruses and bacteria, but also cancer cells. And it does this all the time. And if we suppress the immune function, we increase our risk for cancer dramatically. Think of immunosuppressive illnesses like, for example, HIV. If someone has HIV, if they don't take medications to mitigate the viral load, at some point they develop AIDS, which is acquired immunodeficiency syndrome, which is really a marker where the immune cells have downregulated so much that they're susceptible to many illnesses. And people with AIDS usually die of infections or cancer. And they get a lot of cancers, actually, because, again, the immune system can't fight them off. So again, the immune system is crucial, and vitamin D3 is the key to activate it. And without adequate levels, we are really screwing ourselves here as a general population, because it's a simple step that we can take to really defend against these diseases. And again, now I keep coming back to this point, but it's a shame that it's not more talked about in the primary care setting. We do all these exams for our general health, our preventive health screenings. We check your cholesterol, mammograms, and all these things. That's all great and wonderful. But no one ever checks the vitamin D level. And this is one of the most important things in long-term health, and it's just not done. And the interaction of vitamin D3 with the immune system becomes clear in some studies that have been done. For example, vitamin D3 reverses immune suppression that is created by tumors. So tumors can also suppress the immune response, right? And this allows then the immune system to recognize and attack cancer cells more effectively. So one of the mechanisms that cancer cells have is that they can actually themselves drive down the immune response, which is, of course, something that allows them to proliferate more. And vitamin D3 can really mitigate this to some extent, right? But it also impacts other immune cells in the tumor environment, and it can restore this anti-cancer immunity. So it really helps the whole environment around the tumor to function better to attack the site, right, where the problem has occurred. And as it comes to the B cells, which are part of the immune system as well, of course, it can increase their function and can ensure antibody responses are appropriate and limiting autoimmune activity. So again, this is one thing with autoimmune disorders I talked about earlier. Sometimes there's an overreaction. So there's when the B cells are really making antibodies that are not quite appropriate, and vitamin D3 can really help to make sure that the correct antibodies are produced. There are some diseases actually where the wrong antibodies are produced, or antibodies attack our own cells, which is then, of course, the hallmark of an autoimmune disorder, which we don't want. So in someone that has an autoimmune disorder, it's also absolutely essential to optimize the vitamin D levels, because this can greatly help them to regulate the immune system better again. So then the question, of course, always comes up, how much vitamin D3 should I take? And I get this all the time also on our Instagram channel. Now I would say that the recommended daily allowance of around 800 international units is just not sufficient. I can tell you what I take currently. I take between 5,000 and 10,000 international units of vitamin D3 with about 300 to 400 micrograms of K2, 25 milligrams of zinc, and at night I take 250 milligrams of magnesium glycinate. Now that works for me, but I'm checking my levels. So I don't make this as a blanket recommendation for anyone. You should always check your levels, especially when you're stable on a certain dose of vitamin D3. Some people need more, some people may need less. It is probably not good to go over the reference range. Now I give you, the reference range is problematic in my opinion as well, because yes, we do look at a segment of the population and we take an average value of these blood markers. So that is not always great, because if as a whole population we have a deficiency, we might have a lower reference range than we might actually need. Keep in mind also, if you spend a day at the beach in the sun, you will have a very, very high level of vitamin D3, right? So it's not necessarily that you overdose. But the problem with taking way too much, and this has happened, very rare, I must admit, but in the literature has been shown there can be hypercalcemia. So vitamin D3, one of the functions that it has is that it reabsorbs calcium in the large intestine, which is important, of course, for bone health and all that, especially when you take it together with vitamin K2, because the K2 is needed to direct the calcium back to bone. If you don't have enough vitamin K2 and you take a good amount of vitamin D3, then this extra calcium you reabsorb may actually go to arteries, for example, and it can cause hardening of your arteries, calcification, which is what you don't want. So you should always take your vitamin D3 together with K2 at least, right? And then zinc, magnesium as well. But again, check the levels. And in my opinion, 50 to 70 nanograms per ml is a great place to be in that reference range. Usually reference range goes from 30 nanograms per ml to about 100. If you go above that, people get quite concerned. I would then still say, hey, if you're functioning and if you, let's say you have an autoimmune disorder or you currently have cancer, again, talk to your physician about where you should be. But it's less likely that you will have a big problem there with hypercalcemia. That should, of course, be monitored. It's something that can be a problem, but it's very, very rare again. Most people don't take enough. I supplement year round. I take less in the summer if I'm more outside, and I take more in the winter. You know, that's kind of how I regulate, but I do check my blood levels. So again, something that you should look into, what the right level is for you. In my patient population, most people take around 5,000 international units daily with about 200 to 300 micrograms of K2 always. And they do quite well. Sometimes they need more. If they're sick, I will give them actually more, right? And that's something that I will then follow with labs. But all in all, I think the main thing from this video I want people to take away is that really, if you're sick especially, or if you have a loved one that's sick, suffering from a major illness, please make sure to check the levels at least. Have their doctor check the levels and then supplement accordingly. Don't just use the D3, use the combination with K2. Add in zinc and magnesium. It's very important for proper functioning of this and to decrease any effects that you might have in terms of having too much calcium reabsorption. But I can't stress enough how important this is for our general health. And again, my frustration is that my profession is not catching on to this, that we are chasing all these markers in order to do preventive health, when in fact, we're not really doing preventive health. We're following disease progress. So in my opinion, preventive health should absolutely include measuring your vitamin D3 levels and dosing adequately for you to get to the right reference range, because this is highly protective and can greatly improve your immune function and with that improve your health.